Welcome everyone. We can get started with our Strengthening Families Technical Assistance Clinic, which is how we're using our normal monthly webinar time this month. I'm glad that so many of you are joining us, and many people sent in questions, so we are ready to get started and hopefully answer a lot of those questions and hear your answers to the questions as well. So without further ado, I will get us started. We recently switched to using Zoom webinars instead of GoToWebinar, and I know that many of us are spending a lot of our time on Zoom these days, so hopefully this isn't too different for anyone. But just wanted to make sure you're aware that while we're in this Zoom webinar mode, you can raise your hand, which will prompt us to unmute you. And then you'll get this notice that pops up, the host would like you to unmute your microphone. So we're not able to actually unmute you and have whatever background noise is going on come through to everyone, but we can say that you should be unmuted and then you can unmute yourself. You can also type a question in either to the Q&A, where only those of us who are the hosts and panelists can see it, but we can type an answer and then everyone can see it if we share that. That's a good place to put a question that you would like us to read out loud and addressed to everyone. Or if you have a question like, my audio is not working, which I guess if that's the case, you can't hear me saying this right now, but if you have a sort of technical question, you can put it in there and we can just respond directly to you. Otherwise, I encourage you to use the chat and set the chat settings so that it goes to all panelists and participants or attendees so that everybody can see what you're saying, and that way we can kind of have ongoing conversation there, where the Q&A box is a little more targeted just to the panelists. So, all that said, you are on mute automatically. We can unmute you. If you know that you have something to say, let us know. A little bit of housekeeping. We do these webinars once a month on the second Thursday of the month. It's an open invitation to folks who are using the Protective Factors Framework and coordinating Strengthening Families efforts. When I say we, I mean my organization, the Center for the Study of Social Policy, and our partners at the Children's Trust Fund Alliance. We have a different topic or guest speaker every month. About once a year, we do these technical assistance clinics just to answer whatever questions come up. But in general, we'll have a topic with a guest speaker, and we welcome your suggestions or volunteer. If you say, hey, I have done some great work I'd love to share with the network, please reach out to me and we can get you on the calendar. Also, all of the recordings and materials from past webinars are posted on a Google site that the Alliance maintains. And Lucretia has even already today put up today's slides. So if you're looking for the slides, they're there already. The recording will also be there probably tomorrow, let's say, but sometime soon after the recording is made, we will get it posted there. And as I said, we do this each month at the same time. September 10th, that topic is still to be announced, so keep an eye on your email. And on our social media and other places to find the topic and registration link. That will be coming soon. And I wanted to share that on October 8th, we'll do an introduction to strengthening families during this time, which I don't think we've ever done on these webinars, but we wanted to do that as a pre-conference event for the Together for Families conference that's the following week. So if you are planning to attend, or if someone you know is planning to attend the Together for Families conference but doesn't already know strengthening families really well, they can come to this intro session. And if you just have somebody who's newer to your leadership team or your organization and you'd like them to get that overview, you don't have to be attending the conference the next week to join the webinar on October 8th. So that registration link will come up as we get closer to it as well, but I just wanted to flag that in case there's somebody in your circle, whether they're attending the conference or not, who needs a little bit of a intro to what Strengthening Families is all about. And those webinars, topics, and registration information is always available in our Strengthening Families e-update newsletter. If you aren't subscribed to that, I encourage you to go to cssp.org and click on the Stay Connected, some box like that at the bottom of every page. You can put in your email address and then you can actually choose from all of our newsletters and subscribe to the ones that you're interested in. We also have an upcoming events page where these webinars get posted, and on that Alliance Google site where the recordings are shared. So for today, I'm going to share some quick updates from the Center for the Study of Social Policy, and then Teresa Rafael is with us to share some updates from the CTF Alliance. and then we'll get into the Technical Assistance Clinic with your questions, and Teresa and Lucretia and I will all be offering our answers, and we hope that you will all weigh in as well. All right, so updates from CSSP. I only have a few this month. One is that I recently sent out a survey to the state leads for the Strengthening Families work in all of the states that are currently part of our network. The Strengthening Families National Network includes all of the states that are in dark blue on this map. If your state is in dark blue and you don't know who the state leads are for your state, but you think maybe it should be you, please contact me, because maybe I need to connect you with your other partners there. If you are a state lead and you missed that email, please look for it or let me know if you need me to get you the information in another way. The states that are in light blue on this map are ones that are not currently part of our network, but where we know there's statewide Strengthening Families work going on. If you're in one of those light blue states, we would love to hear from you. Or if you're in one of the states that's not shaded in at all, and I'm wrong and you do have statewide work going on, please let me know. We would love to add anyone to this network. In fact, with the survey that I just sent to the state leads, this is a great opportunity to just join the network. Let me know if you have enough statewide work going on that you think it's time to start coordinating it and connecting to the network, and I can send you that survey and we can just get you moving right into the network. I will also say this is a point in time where if I don't hear back from some of the states that are currently colored in blue, we might be changing the shading on that. We just want to have a more up-to-date view of who's really actively implementing Strengthening Families at a statewide level. And so if I'm not hearing back from folks with this survey and other outreach, we may consider some states no longer part of the network so that we're not misrepresenting where the work is going on. So saying that in the nicest possible way, being strength-based and all, but we are going to have to take some states off our list of who's in the network, and we will hopefully also be adding some so we're getting a more accurate picture. Again, contact me if you have any questions about where your state stands and all of that. Oh, one other thing I should add, this shows states, but we also have Guam as a member of the national network, and would be happy to add other territories and the District of Columbia. So if you're in one of those places, please don't feel intimidated by the word state. All right. To the Together for Families conference, as I mentioned, is coming up in October. Hard to believe we're almost that far into the year. What an odd year it's been, but we are excited to do this as a virtual conference. We're learning a lot about how to make that engaging for everyone. And actually, we currently have discounted early bird registration available just through tomorrow. So if you have been thinking you'll probably go to this conference, but you haven't, filled out the registration form yet, do it by tomorrow so you get that discount. And of course, you can still register afterwards, but we'd love for you to take advantage of that rate, and we'd love to know that you're coming so that we can plan on you. I should say that is co-hosted by Be Strong Families, CSSP, Families Canada, and the National Family Support Network. And the Children's Trust Fund Alliance and Prevent Child Abuse America are both partners in this conference, and we are excited to bring together all kinds of people who care about family support and trying to help families do the best they can, including professionals and parent leaders and funders and anyone else who wants to join us. And my final update from CSSP is that the request for applications for new sites that want to implement Dulce, those are due August 21st, which is a week from tomorrow. And if you missed it on the last webinar, we shared more about what this is all about, but Dulce is a clinic-based effort to reach parents of newborns with family support specialists in the clinic and connections to medical legal partnership to support families' concrete needs and other protective factors when they have very young children. So if you think you might have a clinic or network of clinics that would be interested in implementing that, please look into that RFA. You can email dulce@cssp.org to get more information, or if you get our Link Up newsletter about early childhood system building, it came out earlier this week, and it has all the links to all the information about that request for applications. All right, I'm going to hand off to Teresa to share some updates.
Thank you, Cailin, and hello, everyone. Welcome. I will be brief with Alliance updates, but we keep hearing questions, and some even came up in the registrations for this webinar about virtual resources. And we can talk more about that later, and we will, but I wanted you all to know we have a number of things available on our website. Some of these we've had for a while. This document is on our website, and it's kind of a guide to other materials that are good for using in virtual conversations with family members, with parents and grandparents. And you could go to the next slide. We'll just point out a few of the things that are there that you could start using right away. Also on our website, that's going to be the home for all of these items. And to let you know, if you're working with families who are feeling stress, and many of us are these days, if they are interested in joining the Birth Parent National Network through the Alliance, we're hosting Monday morning caring conversations, sort of a peer support vehicle, parent to parent, and it is for members of the BPNN. And then you'll see some resilience takes time, social media campaign items as well on our website. And next slide, please. We've had some materials on the website that relate to conversations around protective factors. These could be done easily virtually. When we first put them together, we thought they would be used in a group. And many of these materials, I should point out, were developed by the parents in the Alliance National Parent Partnership Council. Lucretia is the co-chair of that council and could speak to that later if folks are interested, but they really are by parents for parents. And so these were adapted to really focus on during this time of COVID. What are the conversations that we need to be having about protective factors? And the next slide. Many of you are familiar with community cafes. We just wanted to point out this resource is still on our website, and cafes work pretty well virtually if you're using breakout rooms and things like that. So the guide, it's about 25, 30 pages with a lot of information, is available as well for download. And the next slide. Again, just more tools. I won't say a lot about them. We've had this one for a while. I think you've seen it, but it's something you can share virtually and then have a Zoom or other virtual conversation, even a phone call. And the next slide. This one I talked about last month. I won't say much about it, except that for birth parents and who have children in foster care, and for foster parents, these are great tools for how to have conversations they need to have, and those are often happening virtually right now. And the next slide. I put these different slides in. You could keep going. That just tells you a little more about those guides. I put these in so if you look back, you'll be able to see the web link for these things. And these are materials, again, by parents for parents, what parents say about some pretty in-depth and challenging topics that relate to prevention, intervention, helping families stay strong, using protective factors in various settings. And then the next slide, I think we may be at the end, but what do we have after this? Oh, there we go. The online training with protective factors. I know you all probably know about that. And all those links will be in the PowerPoint if you see it later. Thank you all. I just wanted to do that virtual reminder right now.
Great, thank you, Teresa. And I think as we get into these questions, we might harken back to some of those links that you shared, but folks can download the slides and have the links at hand. Mm-hmm. So, as I said, we do this maybe once a year, maybe a little more than that, a technical assistance clinic, because it's sort of an office hours to come and ask questions about strengthening families and hear both from CSSP and the Alliance, and then also from each other and others in the field who may have experienced similar things and be able to answer the questions that you're either hearing from others or that you have yourself. So we hope to have a conversation going here, both in the chat box and as people, raise their hands to unmute and jump into the conversation. So you've already heard from myself and Teresa today, and Lucretia Rose is also with us. Teresa mentioned that Lucretia is the co-chair of the Alliance National Parent Partnership Council and a great partner, and she'll be able to jump in on some of these questions as well. So just a little reminder again, you can raise your hand or you can chat. I do see that one question actually already came into the Q&A. And so I'll go ahead and just ask this, Teresa. It's a question from Nikki Baker asking, is the Resiliency Takes Time on your website? I think you mentioned being on social media, but it's also on the website?
Yeah, everything I showed is on the website.
Okay, great. All right, so see, that's how that works. Q&A is typed in and we can answer. Sometimes we can answer in writing and everyone else can see the response, or we can respond directly to the person who asked. So here's how we're going to do it. Based on the questions that were submitted in advance, so some of you, when you registered, put in a question. We probably have more questions here than we can get through, and we want to keep some time for questions that come up as we go too. But we're going to start going through those. We've grouped them into some general categories. So if you see one of these that you're like, ooh, I have so much to say about that, start thinking now. And you can jump in or type in the chat box or let us know that you'd like to join the conversation for one of these particular topics. So we're going to start with cultural relevance of the protective factors and whether there are materials in other languages. The person who asked this asked both of those at the same time, and they really do go together. So I'm going to start by answering a little bit on that, and then I think Teresa, Lucretia may also want to jump in. But I will say the protective factors framework is developed to be universal and is based on research that shows that it would be universal across all families, but that sometimes some of the protective factors are expressed differently or manifest differently depending on the family's culture and history and background. So, for example, knowledge of parenting and child development is something that is very culturally driven. What exactly we consider good parenting and what kind of strategies we have to manage children's behavior, all of that can be very different from one culture to another. Even things like some of the developmental milestones that we expect are different across cultures for how many months old a child is when we expect them to do certain things. That can all be culturally driven, but the fact that parents need knowledge and understanding of that and of their role as a parent is universal. So we have to be careful about places where we where we certainly need some cultural humility to not say, oh, this parent doesn't have any knowledge of child development because they thought this. That's a point to question. I wonder if that is universal. The piece of knowledge that I'm thinking this parent should have may not be universal, but ask the parent about what they do know and where that expectation comes from, and work with them on that. Don't assume that someone doesn't have knowledge just because they don't have the same knowledge that you have. But the concept of knowledge of parenting and child development is universal, that all parents need that in order to thrive and to help their children. And then I'll just quickly share, I think, Teresa, you may be able to share more about some of the cross-cultural work that community cafes have done, in particular with different cultural groups of parents defining the protective factors in their own words and all that. But I did want to share that we have a list of translated materials on our website, and there are a few things that are listed there that are materials in Spanish that are formally available and translated, but we know that so many of our network members translate things into the languages that they need them for their communities. So on that page of our website, you can see there's a list of, there's a few documents themselves. Then there's a link to a Google folder and a Google form where you can enter things that you have and put them in that folder so that others can access them as well. And in that folder, we have materials in Spanish, Mandarin, Haitian, Creole, and a couple other languages that I'm not remembering right now. So there is a great variety. We would love to have more because, someone translated some materials into Haitian Creole because their community needed it, and the community on the other side of the country might also need that. So we wanted to just make that available. We haven't vetted them. I don't speak those languages and haven't been able to look at them and know, you know, that it's exactly how we would want it to be said and all of that. But it is, you know, someone who knows Strengthening Families oversaw that translation and has shared it with families in their community in that language. So we want to make that available in sort of a crowdsourced way. So please check that out and add to it if you have materials there.
Yeah, I'll just add, I think everyone probably knows that for the protective factors training, the training of trainers that we provide, all of those materials for the participants have been translated into Spanish. So if you're working with someone who's a certified trainer, they'll have access to all of that. Some of the videos we had to subtitle. We didn't have the appropriate Spanish language videos, but everything, if it's either in Spanish or subtitled in Spanish, and most often translated already. We're also translating the online protective factors training into Spanish, and we have a couple of courses finished. We're doing them with our partner Care Solutions, who's now hosting the training. So it will always be free, Spanish or English. Or if you want CEUs, then you pay a really small fee to them for that. They have that capacity. And Cailin, you mentioned the different words for protective factors. We do, in the materials I was showing on the website in that same area, you'll see where the Parent Partnership Council looked at what does Be Strong Families use? What do parents there say? What do other groups of parents use when they're talking about protective factors? And you'll see that all laid out. Yeah, there's probably more. Many of the materials I mentioned are in Spanish and English, and so it would be worth a visit to the website. I know language doesn't encompass everything for culture, and part of our work in working with parents as partners is to really just ask questions. You mentioned humility, Cailin. It's really about asking people to help guide us in how to best do the work in their community and giving them whatever tools we have to be partners in that way. Well, I'm sure on this call there are probably some really great ideas if we have time.
Great. Thank you, Teresa. I saw a question came in asking about subscribing to weekly webinars. Is the Alliance doing weekly webinars? Because I can see for CSSP, we just have the monthly ones.
Yeah. I'm assuming that they're talking about the caring conversations that are offered to BPNN members. And I'm actually typing in the chat box the answer to that, and I'll list the website information where you can sign up. In long story short, you would need to sign up to be a BPNN member. And then once you're a member, and a member can be anyone from a parent to an organization, lots of different national folks are members of the actual BPNN. And then once you're a member, that is offered to our members on a weekly basis. And we would love to have you.
Thank you, Lucretia.
Great, thank you. All right, let's go to the next one, which is a question about supporting parents virtually. So I'm going to read through what these questions are because they all kind of intertwine, and then hope that Lucretia and Teresa will jump in with responses. So some just broad, how to engage with families virtually, how are we connecting virtually and really seeing family interaction, how to engage families in virtual services when establishing relationships, which is different from continuing an ongoing relationship and perhaps more challenging in virtual times. And then another step further from that, which is how do we assist parents with working and teaching children at home if their school is closed, and then general trust and family accountability during this COVID time. So I think we're all wrestling with a lot of questions about engaging with families, serving families, supporting families when so much of our interaction has moved online and virtual. So love to hear Lucretia and Teresa, your thoughts, and then I can share some of mine, and maybe folks will chime in the chat as well.
Lucretia, is there anything you'd like to add first?
Well, one, on the national level with the Caring Conversations, we're really seeing, it started out as trying to help folks and parents and families navigate through the COVID crisis, through those weekly conversations, because nobody's ever navigated a pandemic before, right? We don't have anywhere in history that lets us know what we can refer to do in these kind of situations. So at first it started out as a general conversation, wondering how folks were doing, and it has grown into some wonderful relationships, and those conversations each week build upon each other based on what's discussed on the calls. And so we do put a lot of thought into those about what they look like each week, but it's driven by the members who attend weekly. And it's just been really wonderful. And then on the state level here in West Virginia, we took that idea as well, and do a peer-to-peer network of support groups for parents using the Circle of Parents model. And we've adapted that weekly Caring Conversations dialogue as well. And it's just really been wonderful. There's just something about not having a formal agenda, but getting folks together and talking about what they're facing. And we're learning a lot from each other. And there's a whole lot of resource sharing going on, and a lot of connections. So that's been my experience with connecting virtually lately.
I will add that one of the really creative things, and I have to credit Lucretia and the folks who are managing those Monday calls, but one of the creative things is at the beginning of every Zoom gathering, they do a poll with just one word about how you're feeling today. And, it really kind of takes the conversation into thinking about how you're feeling, connecting, but then they'll use those words from the poll and make a word cloud. And, with the word cloud, the more times the word shows up, the larger the word. And so they could notice over time, people felt pretty hopeful and committed. And then probably, I think, Lucretia, in about May and June, when it was pretty clear this wasn't going away for the summer, there were some heavier words. People were struggling some, and it really just was a good place for people to check in. It just took a couple minutes, and then they could talk about whatever they wanted to share, but that anonymity of the poll really let people put their feelings out there. The other thing I'll say is some of the trust funds we work with and the community partners that are their grantees have done some really creative things using, some have used Facebook chat as a way for people to be able to talk to each other in an informal way, or to even have activities for the kids, that somebody might read a story or do a story time. And then in a few places, they've tapped into kind of the free public service television links, if they have those available. And they might be doing family activities for the kids, or parenting information, just a way to communicate and keep people connected as much as possible. Those are never as good as being in a group or in person, but they've had some good results with them.
That's great. I was going to share a couple of things that I've heard from other, service providers and folks who are trying to engage parents in services, either to keep relationships and connections going, or to start serving a family they haven't served before. I think there's a lot of power to individual check-ins before you're asking someone to join a group. People may be intimidated, not sure what they're getting into. That actually may be easier for some people in a virtual setting than it would have been to, physically walk into a room of a group where they didn't know everyone, and where it would be really obvious if they left and all of that. So in some ways, making it clear that people can drop in and learn about something and not have to make a commitment, but also, reaching out in advance and saying, do you have any questions? Make sure someone's going to be comfortable, just like you might, literally stand with them at their first time at a group meeting. Another thing, we often talk about the importance of providing childcare during meetings and providing food to help families, incentivize participation, but also just to make it logistically possible for families to engage in our services when they're in person. And I think I've heard some interesting ideas around that. Not as much with the childcare, though, providing some activity for the children to do, or inviting children to participate in virtual settings is good. But on the food side, I was really tickled by this idea that a group in Boston had, where they were doing their in-person meetings. They had a budget to provide food, and then they weren't able to do their in-person meetings. So they switched that budget to each week during their meeting, they would hold a drawing for the parents who were participating, and whoever won got dinner delivered to their house the next night for their family. So I don't know if it was, just a Grubhub gift certificate or something, or if it was an arrangement with one particular restaurant, but that's an incentive. It recognizes that parents are juggling a lot and say, well, we can't give you food right now in this meeting, but you have a chance to win for that tomorrow you don't have to cook or you don't have to provide food for your family for tomorrow's dinner. So I think there's some creative ways to do that, both in terms of incentives and just, kindness of making sure that people feel comfortable and doing whatever we can. Any other thoughts on this sort of question about the virtual support of parents?
The only thing I would add is the fourth bullet point, if folks are seeing the screen, about assisting parents with all the school issues, is that we've had those Monday calls and some other conversations too that have focused on that a lot. And sometimes just, sharing, knowing you're not alone, knowing everybody else hasn't figured it out, but you haven't yet, can be really helpful. And people do figure things out and then they can share. So it's a great learning opportunity too, just to create the space for parents to have those conversations.
Great, thank you. All right, and then the next level of that is virtual training for professionals. And so, Teresa, the question that came in was, would like to hear ideas about taking Strengthening Families training virtual, not exclusively, but including the Alliance's curriculum. So if you want to address that, and then we can hear what folks are doing for other trainings.
I'd be happy to. We, when COVID hit, we had to cancel we had a number of in-person trainings scheduled. So next week, we're holding our first virtual training of trainers. It's for a group in Ventura County in California. We have one scheduled in Michigan, one in Tennessee, in pretty close succession over the next couple of months. So we've had a high learning curve because we didn't want to just do the same thing virtually that works in person, and we thought about things like using avatars or how to really make it meaningful. And Martha Reeder, Maureen Holliker, Martha's with the Alliance, Maureen is our lead trainer, and some of our other trainers have been working very hard for several months to revamp the training to have a virtual format. So we consider next week our piloting of it with real people as participants, and we'll learn even more then, I'm sure. And we'll be sharing that. They've been talking about, just the technical aspects as well as the content aspects and how to take that out further to the certified trainers and those that the trainers work with. So we are sort of bursting forth soon with more information. But we'll know a lot more after we go through we're doing 4 days of about 4.5 hours a day, as opposed to 3 packed full days that we would do in person. So we'll share more. We'll know more next month on our call.
Great. And Heidi with the Michigan CTF typed in, we're excited to send a few direct service providers to the training of trainers in Michigan.
We're excited about that too, Heidi.
All right. And I think, I think training in general, everybody's figuring out how to do this. I think we all know intuitively that an 8-hour training in person can be engaging, but an 8-hour training online is a lot harder. And so learning things like giving people long breaks and finding ways to do interaction and engaging. I'd love to hear if anybody else wants to type in. Maureen Durning in Idaho typed in, we've also done some virtual trainings and find them to be efficient in many ways. It's true. It's kind of funny how you can get some things done more quickly and more efficiently than in person, because some of what you lose is that in-between time of people chatting, and when that's not really possible, you can get right down to business. Also, there are people who would love to attend trainings but can't travel for them, or especially if it's a multi-day training, they can't be away from their families overnight, and so they can actually engage in some things that they couldn't before. We're certainly hoping to find that with the Together for Families conference moving online, that some people who wouldn't have been able to travel to Seattle may be able to participate with the with it being 3 half days online. So we're all learning as we go and hopefully getting better and better. Lynn Arner wrote in, we add brain breaks. Yes, definitely. And I think people need to get up off their chairs in front of their computers and have permission to turn off the camera sometimes and all of that. So there's a lot to it that we're all learning.
Cailin, I'll add one more thing. Week after next, we're hosting a virtual meeting that we always hold in Seattle in August, but it's with birth and foster parents, the group that developed some of those materials I shared. And we always paid childcare costs for parents to come to the event. But what we're finding is that even with the virtual training or virtual event, they still need childcare because it's 2 big chunks of time, 2 days in a row. And we're happy to do that. So, there are cost savings when we're not paying for people to travel, and we can invest it in helping to make sure they can get the best virtual experience possible.
Yep, that's a great point about childcare. Maria Doyle just typed in lots of great training, online training resources at trainingforchange.org, which Lucretia enthusiastically endorsed, and I agree. Great resources for training in general, and I'm glad to hear they're beefing up their content on online training. And then Maureen Durning added, we do 2-hour chunks with an hour break in between. I think that's really good. You need enough time to actually move around, maybe do something else, and just not be staring into the camera for a little while. All right, let's keep us moving here. You can keep adding into the chat if you like, but our next set of questions was around helping families in general, and especially those who may feel overwhelmed or who are resistant to help. So here we've got how to help without families feeling bombarded, which I think can certainly be an issue in this time and always. How to support a parent who's in crisis but doesn't want resources or support. Any good suggestions, training, or info about helping families build healthy support systems, and orientation to parents about positive discipline and behavior. So I think these are all, we could talk about each of these separately, but I thought it might work as kind of a cluster of questions. I think I actually did a presentation recently where there were a number of questions about parents who were resisting the help that service providers felt they needed. And I think we always need to be cognizant of the bad experiences that people may have, or that their families historically may have had with service providers and with our systems that are, in theory, supposed to help, but we know often that help comes with consequences. And so families can be resistant for very good reasons, saying, nope, I'm going to sort this out. I don't need anybody poking their nose into my business. And so sometimes that we might not be able to overcome that. It might just be the wrong fit, and they might need a service provider who they'll feel more comfortable with. But sometimes, really coming in very strong with the strength-based perspective of coming in as, I want to know what's going well for you, how you've gotten through crisis in the past, who's your support system, how can I help? as opposed to the, I can see that you are really overwhelmed and you need this, this, and that. So there are ways to approach that, but also sometimes just acknowledging that somebody might have asked for help before and had it, you know, really come back at them in the wrong way. And so they're going to be very resistant to asking for help, or their family may have had that experience and they are going to just try to go it alone rather than risk involvement with a system they don't want to be involved in. So I had that thought. Lucretia, Teresa, do you want to share anything about any of these questions generally?
Well, Jennifer Gomez just added a great comment, listening without interrupting to what is a priority for the families and validating their concerns. Sometimes just listening and paraphrasing with open-ended questions can be a great start. And, you know, we do believe pretty much, you know, hopefully we all believe that most often the people who are experiencing the challenge are the ones who have the solutions too. And our role is to facilitate them identifying those. And that's what I think about, Jennifer, when I see your comment.
Sorry.
One of the things I'll say, we have another bit of work we've started that is providing social emotional support and concrete financial support to some of the families we've worked with around policy and advocacy. And part of what we're seeing is some of the parents who have really been in a helping role. So, you know, they've been speaking out, they've been promoting parent voices, and now their income has changed. You know, there are all sorts of issues that they haven't had to deal with as much. And there's a discomfort sometimes in accepting help when people are used to being in the role of helper. And one of the things we talk about a lot is COVID has just been a great leveler in terms of we all need some kind of help right now, whether it's social connections or more concrete support and maybe all of it. So to sort of neutralize whatever concerns people have about any shame or blame and asking for help can go a long way. Just talking about how everybody needs help right now and, you know, how we help each other during this time.
I would just say, from a family point of view, of being a family who has received services in the past and continues to do so in their own community, and then also being a helper, right? So every time that you're in a advocacy role or you find something that works or you take on a new initiative, it's like we have all this great stuff and we want to help you and we can, but and I've even found that with the Alliance's new resiliency project, where we do have the supports to help families and families who have been advocates in the past, and the helpers who've been the helpers in the past. We're a little resistant as helpers to ask for help, right? So we can give it and it's harder to receive it. So just keeping awareness personally, that unless families are ready to accept help and ask for it, that we kind of respect that space. And so in the beginning, if you're working with the family who is kind of resistant, what really works for me and what has worked on both sides for me as a recipient and me as a helper is building that relationship over time, being that listener, and not so much that I know how to fix things or I have these things I can offer you, just I'm here for you, whatever that looks like. And whenever you're ready, you know, there are some things we can do together when you're ready, and if not, that's okay too. But I've found the relationship piece is just really key right now, more than anything. So you may have 10 different conversations or chunks of time with a family before they ever decide that they are ready. And I'm not saying 10 is the magic number. I'm just giving you an example. You may have 10 conversations with the family before they decide they even want to let you know what areas they may or may not need help in. So it's more about building those healthy relationships to be able to be in the place where you can receive or give help.
Thank you both. And a couple of comments came in. Diane Yeo wrote, families have to feel safe. And I think that's really important. And sometimes they need to see that you're going to keep showing up again as a way to build that trust and see that you're a reliable person before they're going to open up to you. Then Jennifer Gomez typed in, agreed, Lucretia, relationship building is the foundation. Maybe offer just 2 options of support that can meet their needs. Too many options can be overwhelming. I can see that too. Yeah, it's like, no, don't tell me every single thing I could do, but 2 things, maybe one of them will work. And if I say no to both of those, maybe there's more. But I think that's a good place to start. Just a couple notes. We saw someone said most of the chat messages were not visible. So when you type into the chat, be sure to select all panelists and attendees. Otherwise, only we can see what you're typing in. So sorry about we didn't catch that earlier on, so that you could have all seen each other's comments earlier. But just make sure you select that as you type in. And we have 14 minutes left. So if you have another question that you didn't type in your registration, type it in now, and we'll keep going through the ones that were submitted in advance. But we will see if other questions come in, just for those of you who are on the line. Okay, so we had some questions that all relate to kind of best practices for presenting the protective factors, and specifically 2 questions about resilience. So one was, do the protective factors need to be presented in a particular order because they build upon one another? We can take that one first. And then there are 2 questions about resilience. So a colleague questioned whether the concept of resilience puts an undue burden on families to solve for and get past systemic challenges. And then another person asked, do you have suggestions or handouts regarding starting a class with parents on parental resilience? So those are all kind of connected. I'll take the first one, that's the easiest one, which is about whether the protective factors need to be presented in order. And the short answer to that is no. You can present them in the order that makes sense for you or for the group you're talking to. There are some theories that go into the order that people traditionally present them in. So I will say at CSSP, we have typically started with resilience first because it feels like everything else kind of falls into place once you understand resilience. I do know some folks who prefer to do it in the opposite way, to put resilience last, because everything else leads up to being able to understand what we mean by resilience. So you can take that either way. I know we did a training early on here in Wisconsin for early care and education providers, and we started with children's social emotional development because that's already in the wheelhouse of the folks we were talking to. And then we went into knowledge of parenting and child development as something that these providers might already feel like they were doing a lot with parents, and kind of went up from there to the things that were further and further outside of their comfort zone. So there's a lot of different ways to go about it, and you can make it work the way that works for you. I will say when we try to break them up sort of into clusters, we often see that concrete support and social connections are very closely connected, because a lot of families can have a lot of their concrete needs met through their social network. Probably not all, but some of their concrete needs can be met in that way. So those kind of go together. And then knowledge of parenting and child development can often go hand in hand with children's social emotional competence, because that's a huge piece of understanding what's going on with children's development and parenting strategies. And then that leaves resilience kind of on its own. It's closely connected to all of them. So just a couple thoughts about order and grouping. Does anyone else want to weigh in on that?
Well, a similar question that comes up often is, if we can only do 3 or 4 of them, which are the most important? And we always say all of them. Doesn't necessarily matter what order, but all of them are important. And I think that's a good adjunct to what you're saying about sequencing. Whatever order they're in, they're all important.
I would just add to here in West Virginia, when we do our state initiatives, primarily we're working with a lot of child care centers and family resource networks, family resource centers. And so we feel like they're really strong in the knowledge of parenting and child development portion of that. So we like to break ours up into chunks and offer them in like duo packages of maybe resilience and concrete supports, or social emotional development, and social connections together. And we do offer the knowledge of parenting and child development, but when we're working with organizations who that's their primary focus, we tend to let them decide if they would like to, focus in on that a little more.
Lucretia, I'm doubting my memory. You'll probably know this better than me, but in the work the ANPPC has been doing, don't you have a conversation guide on parent resilience too? I know you're working through the protective factors. Is that one of them you've already done?
We don't have a conversation guide for the parental resilience, but we do have some one-pagers on our website that we have cast out a survey to parents across the nation, asking them concrete ways that they build their resilience in their communities, in their families, in their everyday lives. And they, on that one-pager, it shows the questions that we ask, and it gives real feedback from parents across the nation of how they give concrete examples of how they do that. We also have one-pagers for social connections and concrete support in times of need. We're working on that now. And we have one for social emotional competence of children. And then we have a conversation guide for social emotional competence of children that you can use to talk with families about how they build those protective factors. And it has directions and lots of different things. And all of those things can be found on our website, along with memes that you can share right now during COVID. I've found working with families that they are overwhelmed with emails and resources and all these things that they're getting. But if they can get information in small, and this is for myself too, if I get information in small chunks, small manageable chunks that are on the social media platform, of maybe a meme with a resource or some things like that, I don't feel as overwhelmed. And so at the ANPPC, we focus on lots of different ways to do that, and you can find those on our website.
That's great. And Cailin, I just had one thought about the middle bullet too, about the concept of resilience. And for years, parents have said periodically in conversations, they didn't want resilience to give the impression that, systems and others could just sort of throw anything at parents and they could tough it out and take it, sort of survive it. And so one of the things we talk about is that it's the ability to face challenges and not just overcome them, but to be transformed by them, to turn them into something that will help you meet your own needs for growth and change, if possible. That might mean you have to really draw on social connections and other resources, but it's not just about individually standing up and surviving, without some positive benefit from it.
Right. I think that question is really central to how we balance our work to help families thrive and overcome what might be really challenging circumstances, and then how we work to make sure that families don't face those challenges, right? Like we don't want to overemphasize that everybody can just be resilient and have grit and whatever we call it next and overcome the challenges they face, without addressing that it's unfair the way that so many families face challenges, and that our systems need to change so that families don't have to keep overcoming all this stuff for so long. So it's really a balancing act. And I think it might be time for a conversation about the phrase parental resilience, or just the word resilience, because when the protective factors framework was developed, resilience had a different meaning. Actually, probably wasn't used as much in popular conversation as it is now. It was a psychological term that wasn't as widely used. Now it's taken on a lot of connotations that it didn't have then. And while I still think our definition of it is strength-based and honoring families' resilience in the sense that we mean it. I think we might need to tread carefully around how people hear that sometimes, and not make sure that we're not putting the burden on families. So that's an important longer conversation to keep having. We had a couple comments typed in here. Maureen Durning said, we always start with the message, 5 protective factors keep families strong. We have them all. I also have YouTube videos based on many of the lesson plans in our strong training manual. So folks who were looking for specific content on resilience might want to look at that strong YouTube channel. Maybe Maureen, you can throw that link in the chat box, and people can look at those tools. Let's see, then we had a comment from David Neptune. With so many families adjusting to distant learning, how are the panelists seeing social and emotional resilience take shape with the stay-at-home orders? Many childcare centers and programs are closed, and families are taking on tasks and feeling stretched thin for the last 5 months. That's definitely true. I think, I would say, the effect on children's social emotional development or resilience is so related to parents' ability to cope. And again, not putting that on parents if they're struggling, because most parents are struggling right now. But I think being at home and being with whatever the family unit is all the time is not inherently a bad thing. I think a lot of, especially the younger the child, the more they thrive in, just having all that attention of their key attachment figures and their closest family members. But if those close family members are also trying to work a desk job on Zoom and also trying to teach a first grader and everything else that's going on, then that becomes less and less positive for the young child's experience. And so not even to mention if the parent is depressed and overwhelmed and worried about paying the rent, then many parents in that situation are not able to, engage in the serve and return interactions that we all hope they are with babies. And so it gets really hard. And as this stretches on, I think some people have found routines that let them cope. But we do know a lot of families are still struggling a lot, and that's hard on everybody, especially the kids who may not have the attention they need, or may have parents that are lashing out or not able to kind of rise to the occasion every single day, all day long, which is a lot.
Yeah.
Not sure if anybody, I'm scrolling through. Hanira Perez asked, do any of you have a parent resilience tool that you can share with me? So Lucretia mentioned the tools and put a link in. There's a tool about each protective factor there, which I think is really useful. I will also say, and Maureen put in the link to her Butterfly Trainings That Transform site. I will also say that on the Strengthening Families website from CSSP, we have what we call an action sheet about each protective factor. I wouldn't say that's basis for a training, but it does have questions to ask parents about each protective factor and things that a caseworker, early care and education, or home visitor can do related to that protective factor. And so those questions to ask might be a nice way to launch a conversation. I can grab that link while we move to the next slide in a moment.
I just wanted to add in too, in response to that question, we have the Conversations for a Better Normal tool, which is questions. We have a facilitator's guide, a participant guide. They're available in English and Spanish, and they are conversation starters around each protective factor, specifically surrounded around COVID-19. So if that's something that you are looking to help families build protective factors surrounding COVID, you can find that at our Parent Voice page as well.
Great, thank you. All right, I went and grabbed the link. Now we'll see if I'm able to get back to my sharing. Hopefully this will work. Okay, we have Oh, we're actually at the end of our time. I didn't realize we finished up there. So I will, Anna is asking for the parent voice link again, Lucretia, if you can add that in. And I will just answer a question here that was on our next slide that is a very straightforward answer. Someone asked, is there a new database system for programs to use when completing the self-assessment? And there is. If you go to strengtheningfamiliesevaluation.com, that's provided by our partners at Mosaic. And it's currently set up where you have to fill out a form to request access, but they will review that and get back to you. I think it says within a day. So you can still access that tool, and it's actually a much upgraded tool that was developed for a group in Northern California that was looking for a specific new system. They've made that system available to everyone now, but you do have to fill out a form to access it. So don't be intimidated by the form. Fill that out. You can still use that tool. And I think we probably have to cut it off there. But thank you, everyone, for submitting questions and for joining, whether you just listened in or chimed in with your own answers and questions. Answers and thoughts. And I just always appreciate this network, how willing people are to share, and the great work that everybody's doing. So thank you all, and we'll be in touch. And thanks, Lucretia and Teresa, for jumping in with all these answers and for all the great work you're doing.
Thank you all. What a treat to be here with you today. Bye-bye.
Bye. Take care.